family, welcome to another beautiful edition of Annie Ota's vlog. If today's your first day watching me, you are in the right place. Please hit the red button that says subscribe, turn on the notification bell, and you will be among the very first people that will be notified whenever I post something new. If you're a returning fan, family, subscriber, thank you so much for coming back. I really love and appreciate you. Please do not forget to share, like, and comment on my videos. This will help me to do much more better. All right, guys, so in today's edition, I am going to zoom in into women's health. So I'm going to be talking about cervical cancer. Yes, this cervical cancer is raging all over the place. So I'm going to give good hints of what cervical cancer is, the signs and symptoms, what we need to do about it, how do people get it, and how it's being diagnosed and treated. All right, guys, so what is cancer? Okay, so cancer is a disease in which the cell in our body multiplies outrageously. It multiplies out of control. It grows out of control. So that's when we say somebody has a cancer. Okay, so in other words, healthy human cells has a set rate at which they multiply, at which they grow, when they die, and when new ones are created. Okay, but when the cell is infected by cancer, it just grows out of control. Okay, cervical cancer is the cancer of the cervix. So where is cervix located? So if mouth of the uterus, that's the womb, that's where cervix is located. So the cancer hits right there. So the American Cancer Society also estimated that about 42 million women has cervical cancer currently. And they also estimated that about 4,280 women will die of cervical cancer this year, this 2022. So who is at risk of cervical cancer? Every woman. Every woman that is sexually active is at higher. According to CDC, that Center for Disease Control here in the US, is saying that cervical cancer is caused by a long-lasting infection with a certain type of human papilloma virus, HPV. Okay, so HPV has different strengths and different types, okay, but there is one particular one that causes cervical cancer. So a woman can be infected by this HPV but still will not have cancer because that particular woman didn't get that type of HPV that causes cervical cancer. So how does a woman get HPV? How does a woman get this human papilloma virus? So HPV is sexually transmitted infection. So according to CDC, at least half of all sexually active people will get HPV at some point in their lifetime. So it's just a matter of the type that you get, okay? So this will lead that person to having cervical cancer or not having a cervical cancer. So if one gets the type of HPV that doesn't cause cervical cancer, it can go away within a year or two without you even realizing that you have something. It will just go away on its own. So what are the signs and symptoms of cervical cancer? At early stage of cervical cancer, there are no signs and symptoms. So that's what makes it very deadly. You will not even feel anything. But as the cancer advances, that's when you start having signs and symptoms of cervical cancer. So as this goes on, what are the signs and symptoms one starts noticing that will be very concerning? Vaginal bleeding after intercourse, and between your menstrual periods or after menopause, then somebody will just start bleeding out of the blues, okay? That's abnormal. Go and see your doctor and find out what the problem is. Watery, bloody vaginal discharge that may be heavy, and it has this unpleasant, foul, disgusting odor. So think about a fresh fish that is rotten, how it smells. Think about an egg that is rotten, how it smells, okay? So when you start having this discharge, watery, bloody discharge, that has the type of smell, please go and see your doctor immediately. That's not right, okay? Every woman should be able to know the normal odor or aroma of her personal private part, okay? So what are other signs and symptoms? Pelvic pain during intercourse, okay? So if you are hurting so bad during a relationship, something is wrong. During intimacy, something is wrong. Loss of bladder control, that's incontinence. So the woman will start losing control of how she urinates, okay? So she will just be losing it anyhow. Something is wrong. Unexplained weight loss. So if you're not trying to lose weight and you find yourself losing weight, go and find out what is wrong with you. Leg pain, leg cramp, okay? If your legs are cramping and hurting you without any known cause, go and see your doctor. Then another one is heavy and long menstrual cycle. All of a sudden, your menstrual cycle becomes heavier, and instead of 4 or 5 days, it's lasting for you to start lasting for a week or two. Something is wrong, and it becomes heavier than you normally see it. Go and see your doctor, okay? Go and see your gynecologist, to be specific. Something is wrong. Again, constant fatigue, weakness, tiredness with no cause, okay? All of a sudden, you don't just have any energy. You're always tired, always exhausted. Go and see your doctor to find out what is going on. Then another one is discomfort while urinating. So when you're peeing, you're hurting, you're burning, you're cramping. It's unbearable. It shouldn't be so. Go and see your gynecologist to figure out what is wrong in that personal part of yours, okay? So there are 2 types of cervical cancer: squamous cell carcinoma. So this is outside the cervix. Another one, the second one, is adenocarcinoma, which is buried in the walls of your cervix, okay? So what are the risk factors of cervical cancer? Many sexual partners, okay? So if you have people all over going into you, you're exposing yourself to STI, and one of those STIs might be HPV. So it's not right to do so. Just have only one partner that is trusted, okay? Then another one is early sexual activity. If you're too young to be participating in things you got no business doing, this can expose you to HPV as well. Other sexually transmitted diseases or infections, okay? So things like chlamydia, gonorrhea, syphilis, HIV, AIDS, okay? So this will increase your risk of having HPV, because they are like get one, buy one, get many free. So you get one STI, one STD, another one might be linked to it. So that's why we need to be very careful. So another exposure or risk factor is a weakened immune system due to other health conditions, okay? So if somebody is going through chemotherapy, or they have other diseases, diagnoses that they are battling, this can as well weaken their immune system. And so smoking is associated with squamous cell cervical cancer, okay? It makes you very vulnerable. So that's why we tell everybody to stop smoking and do not start smoking. So smoking will make you vulnerable as well. Another one is exposure to miscarriage prevention drugs. So there is this drug that women take if they're having threatening miscarriage. This medication also exposes women to cervical cancer. So again, make sure that what your doctor is giving you is not one of those medications. You have to weigh your benefit and the disadvantage of that medication before you take it, okay? How do we prevent cervical cancer? There are so many ways that we can prevent cervical cancer, but the easiest way is to get the HPV vaccine. So check with your doctor, your children's pediatrician, to know if they are good candidates to have this HPV vaccine. My girls have had them, okay? So at the age of 9, check with them. Boys can also have the vaccine as well. Another one is to have a routine pap smear, pap test, okay? So in this, it starts at age 21. So pap smear would dictate precancerous cells in the cervix, okay? So it starts at age 21. It's done every year according to what is going on with your system. If you have a history, and also if you're exposed to HPV, but otherwise the standard is every 3 years if you don't have any problem going on. Okay? Practice safe relationships, safe intimacy. Wear your condom, wear your condom, wear your condom. Again, a sexual partner to one person. Yes. You can't be all over the place jumping with this person, this person, this person. No. Limit your intimacy to one person. Always have annual STD examination, okay, to make sure everybody is cool. Then another one is do not smoke. So if you're smoking already, please quit. If you haven't started, please do not start. Smoking is not good for your health. It predisposes you to cervical cancer. So please stay away from anything smokable. It's not good for your health. How do we diagnose cervical cancer? Cervical cancer can be diagnosed in 2 primary ways. Then the other steps will be taken if there are precancerous cancer found in the cervix, okay? So number 1 is pap smear. Just like I mentioned earlier, it starts at age 21. It can be annually. It can be every 3 years. It depends on what is going on in your body and what you and your gynecologist have decided. Again, if you are at high risk, it will be done annually. If you are not, it will be done every 3 years. The pap smear is a way to detect if you have any precancerous cells in your cervix, okay? Then the second one is the HPV DNA test. So this will test if you have any HPV in your DNA. Otherwise, you're good to go. Then another one is the biopsy, endocervical cortege, electrical wire loop, and cone biopsy. So these are the ones will be done if there is iffy result that you got from your pap smear and DNA test, pap smear HPV test. So this is when the doctor will say, okay, we need to run more tests to confirm what they have, if it's what they're thinking. But otherwise, what you will do is the first one, which is the pap smear. Okay, so how is cervical cancer treated? Number 1 is by surgery. So surgery can be just to cut out the cancer only. Okay, so again, number 1 surgery, it can be just to cut out where that cancer is located before it starts spreading. Number 2 is to remove the cervix, the entire cervix. It will be removed. Then number 3 type of surgery is to remove the cervix and the uterus, okay? So if the uterus is found to have some precancerous cells spreading towards it, it will be better to remove the entire thing before it got engulfed by cancer. So another type of treatment is radiation. Radiation can be externally, it can be internally, or both can be combined to treat cervical cancer. So again, it depends on how aggressive your cancer is. So the doctor will also use aggressive treatment to handle it. Then another one is by chemotherapy. They will give you a drug of chemotherapy to help kill the cancer. Then the fourth and final one is the supportive or palliative care. So at this stage is when everything has been done. The cancer is on maybe stage 4, okay, and there's nothing else to do. Palliative care again is the last thing to do. So to keep the patient comfortable, the patient can be put on antidepressants, anti-anxiety, and pain medication, anything that will make this patient comfortable, and also to spend quality time with her loved ones surrounding her in her last days on this earth. Okay, so I believe I have extended some type of knowledge and created awareness of cervical cancer in this little clip. You can go further and dig further, but I just want to bring the main things just to the spotlight so that every woman will be aware of what cervical cancer is. All right, guys, so thank you so much for watching another beautiful edition of Annie Otto's channel. Please do not forget to share, like, and comment on my videos. I really love and appreciate you. Bye, guys. Bye, guys.